Those of you who do primary PCI for acute ST segment elevation MI always worry about contrast-induced acute kidney injury. But honestly, in the rush to minimize door-to-balloon times and get the patient to the cath lab, contrast-induced kidney injury frequently becomes a secondary issue. Nevertheless, we also know that if contrast-induced kidney injury occurs, it is associated with adverse short and long-term outcomes. Now in circulation cardiovascular interventions, researchers report on how we might easily identify patients at risk by using admission BNP levels to predict the development of kidney injury after PCI. They studied about 1,000 patients from the Horizons AMI trial who had BNP levels measured in the emergency room prior to primary PCI. Contrast-induced kidney injury occurred in 13%. Here's what the researchers found. Baseline BNP was a significant univariable correlate of contrast-induced kidney injury with an odds ratio of 1.3, and after multivariable adjustment for clinical laboratory and angiographic variables, BNP remained a significant independent predictor. In all fairness, an odds ratio of only 1.3 is not huge, but the measurement of BNP in the ER is so easy to do. Thus, the researchers point out that measurement of serum BNP at hospital admission may help identify patients who are at risk for developing contrast-induced kidney injury after their PCI in ST segment elevation MI. If your lab can turn around BNP levels quickly, it might even be information that's available going into the cath lab procedure. Simple, easy, and useful. I'm Peter Block, and this is a CardioSource Heart Minute.